everyone. This is Dr. J with the Human Movement Institute, where we have improvement through movement. Today we will be discussing inner elbow, forearm, and wrist pain relief exercises for musculature that can mimic golfer's elbow. In fact, some of the forearm muscles on the inside of the elbow, the medial aspect of the elbow, can mimic medial epicondylalgia, known as golfer's elbow. So this video is about treating pseudo golfer's elbow, or what we call the gripping gripers. Anybody that has to do a lot of repetitive gripping, flexing their fingers, their metacarpals with gripping and picking up repetitiously can get pain in a whole host of different muscles, up to and including the Pronator teres, the palmaris longus, the flexor carpi radialis, the flexor carpi ulnaris, the flexor digitorum profundus, and flexor digitorum superficialis. Any or all these muscles can cause forearm pain or wrist pain or upper inner elbow pain. So how do we do some exercise to help relieve or release this musculature? In a previous video, we spent a lot of time on Pronator teres. So today I'm going to focus on the forearm flexors and the wrist flexors. Notice that I'm working more medially, just below the medial epicondyle. I can contract flexor carpi ulnaris by flexing the wrist and ulnarly deviating the wrist. I can start with muscle mobilization manually, or I can put the mobility tool down and work along the ulnar medial aspect of the elbow and forearm. I can do active release of flexing and ulnarly deviating the flexor carpi ulnaris, and or I can extend and radial deviate using the extensors to reciprocally inhibit the flexor. Next, we're going to work to the flexor carpi radialis and palmaris longus. Notice when I make a fist, flex my wrist and radial deviate, the flexor carpi radialis tendon becomes prominent. Then I can do palmar aponeurosis or palmar grasping with slight wrist flexion to get the more medial tendon to pop up, which not everyone has. 30% of the population does not have a palmaris longus. Talk about an interesting fact. However, these muscles are known to cause forearm pain and or wrist pain, depending on which muscle. For example, flexor carpi ulnaris can cause medial forearm and elbow pain more to the medial aspect of the wrist, where the flexor carpi radialis can cause more anterior forearm pain down to the lateral anterior aspect of the wrist. So I can tease out different musculature by doing different muscle actions. Wrist flexion, radial deviation. So now I'm doing flexor carpi radialis muscle mobilization. I can do the palmar abduction motion to get palmaris longus. Then I can work over to the side for flexor carpi ulnaris. Now, the flexor digitorum superficialis muscle occurs with blocked PIP motion. So when I do this motion of the first middle knuckle, or the third digit proximal interphalangeal joint, I'll feel the muscle activate clear up in the forearm. These are often best released with a forearm over forearm technique for more pressure. And notice that I'm actively extending the wrist and hand to release or stretch the flexors during mobilization. Coming in from side angle can allow me to hit flexor digitorum profundus, which has a big, broad medial attachment along the ulna and the intermuscular septum of the forearm. We will do videos later on how to isolate different muscles during different muscle action. For today, we want to teach you how to mobilize and release different musculature. Starting dose for this whole area of the forearm might take you 5, 10, or 15 minutes once a day or every couple days. A good follow-up to release or relax your gripper muscles is to do seated or supine stretching. Depending on the angle in which I take my wrist and hand will determine if I'm stretching flexor carpi ulnaris versus flexor carpi radialis versus palmaris longus, or I could use the wrist and finger extension test. If you're unable to extend your digits passively to roughly 90 degrees, you probably have tight forearm flexor and finger flexor muscles. So I could use the test as a stretch. Initial starting dose, 30 seconds to a minute, 3 times twice a day. Make sure you're doing calm, relaxed breaths. Personally, I do different angles. So I do from here to forward to up to facing me. I also work one fingers into further flexion than the other. So you can be very dynamic and functional with your stretching. And then one of the easiest to do is lying down. I'll do this if I've done a lot of work where I have to grip and lift and carry. I'll wake up the next day feeling like a vice grip through my forearm. And usually I use my pronator more, which is why my forearm wants to pronate. So here we can stabilize the humerus, supinate the forearm to stretch the pronator teres. Might even get a little bit of pronator quadratus. Gently extend the wrist and extend the digits. Due to the positioning of this stretch, you need not be aggressive. The position itself will help release or relax the forearm and finger flexors. Initial starting dose, hold for 30 seconds to a minute, 3 to 5 times, couple times a day. It'll take anywhere between 4 to 6 weeks for the musculature to have an improvement in flexibility or to decrease the tone in the musculature that could be causing inner elbow, forearm, anterior forearm, and or anterior aspect of wrist pain. This concludes our video for treating medial elbow, inner front forearm, and anterior medial and lateral wrist pain video. If you like this video, please share it with your friends, family, patients, and colleagues.